Hello, everybody. Thanks for coming back to the show. My guest for this episode is Devabhaktuni Sri Krishna. He's the founder of Patient Know How, and in this episode, we talk about some of the mask information that he has on that site. And overall, we mainly cover masks and respirators and the current crisis in India. So this episode is sort of a mishmash between episodes 9 and 12. So that being my episode with Nicholas Smith on respirators and masks, and the previous episode with Dr. Reina on the crisis in India. Shri is an absolute delight to talk to, and I'm very pleased I was granted the opportunity to speak with him. So, hope you enjoy the episode. Cheers, guys. And thanks for coming on. So, just run over for everybody who you are, what you do, and how you got into doing masks during the pandemic.
Sure. It's a great question. I was back in 2014. I was involved with the Ebola epidemic, and that was a really. I even got the way I got involved there was quite surprising as well. In the 2014 timeframe, I was at a medical conference, and the there was the Ebola crisis was just starting. A few days before that, the CDC director had declared that this was the biggest crisis of his career, apart from AIDS. Then I was very concerned about that. Wow, the CDC doesn't have things under control. And so I started. When I met someone at the conference there who was a public health professor. So my background is in technical background is in engineering from MIT and Caltech. And earlier in my career, I was the founder and CTO of Tropos Networks, which builds Wi-Fi mesh networks across cities and utilities, for cities and utilities. So large scale, hundreds of square miles type Wi-Fi networks. And so I have some understanding of how to build scalable systems and wireless networking. But I really hadn't had any public health background, and maybe that was actually a good thing because I looked at things very differently. I started collaborating with a professor Ranu Dhillon, who has a lot of experience in developing country health systems in Africa, Asia, India, even including the countries that were affected by the Ebola epidemic. And so we started it was fascinating just talk to him and question and like what happens if Ebola comes to America? What do we do? And then about a month later, we put our thoughts into a paper that we started iterating on, just trying to see how we solve the problem, and that ended up in the Lancet. And then the president of Guinea asked my co-author to fly back with him from New York to Guinea on the airplane. He was visiting New York to meet with experts, and so he literally hopped on the plane with him, went back to Guinea. Was supposed to be there for 2 weeks. He ended up there for 6 months, and I was on with him phone with him every day, designing the Ebola response in Guinea. And so I got a crash course in how to control epidemics of novel viruses, which you really can't learn in school. I guess there's no course. You can study case studies and stuff, but this was a real course and a real life. And we learned so much about how the public health agencies operate, and we started to look at them as really unable to deal with this type of emergent situation. They were very comfortable dealing with Ebola in rural areas in West Africa, all over Africa. Ebola pops up here and there, and we don't hear about it because the WHO comes in or someone comes in and contains it and deals with it in a very standard procedures. Whereas when it popped up in an urban area, it completely caught these agencies by surprise. They were unable to address it. The local governments were able to address it. So that's where we needed some new thinking, innovation. Ultimately, the population had to really embrace the problem. And ultimately, a lot of the public health experts, including myself, believe that it was the population's own recognition of the problem and their own solution that really stopped the spread. And that, in addition to all the things that were being done by the public health folks, and so this that really opened my eyes. And I have many publications that in public policy now and mathematical modeling with epidemics with doctors and medical experts and on rapid testing of infectious diseases as an intervention. which was this is Ebola and Zika and Lassa fever, and most recently coronavirus. And so in conducting these studies, I started looking at rapid testing back in March of 2020, actually in January of 2020, and then I learned that basically we started modeling and realizing that this virus is spreading without any symptoms, and it's supposed to be spreading with a very high level of contagiousness without symptoms. Then that we need something else to control the virus beyond rapid testing. Rapid testing is good, especially if you have symptoms. You can come in and get tested, but you need something else to moderate the chain reaction. And so this is what well, we started looking. Wait a minute, what about masks? And we started looking at it more. It's like, okay, masks are great, but the masks that are also so I published a preprint on this and the combination of masks and testing, and then they that led to that got cited a lot by a number of different health officials, and then realized that not only do you need masks, but you need masks that are going to stop the transmission from person to person. And so the cloth, unfortunately, was being initially was rejected by a lot of public health agencies, and then they turned around and said, "Yeah, everybody wear cloth masks." And while that was a step forward, that was a but let me just background. The cloth masks were standard and routine in many countries to begin with, in especially East Asia. In fact, they were talking about why aren't the Western countries using cloth masks? And then suddenly, they changed that the U.S. and other countries changed their mind and said, "All right, let's use cloth masks." And then so everybody started wearing cloth masks, which was probably the most rapid adoption of any consumer product in history, as far as I could tell. I mean, I've never seen another consumer product be used by so many people so quickly. But then at the same time, what ended up happening is these cloth masks don't stop the spread of aerosols over the fine particles. And there was a debate around whether these particles are that people spread the virus through these tiny particles that are exhaled and inhaled. And that debate's been going on for the last year, and Jose and Nicholas have covered this very extensively. And so that's where I realized that writing's on the wall. This is an aerosol spread virus. These cloth masks are good, but they're not going to work. They're not going to protect me. They're not going to protect my family. They're not going to protect any people from getting the virus. So my wife's a doctor, and she needed something very to protect her every day. And what we have now come to realize is, so that's where I began looking into what are the available options. And I discovered, to my surprise, that in spite of all the great effort put into telling people that N95s are only for healthcare workers and N95s are not available and don't look for N95s, it's almost this active effort to discourage use of high filtration masks. I realized that there's actually masks that are, and healthcare workers themselves were struggling to get access to disposable N95s. There was off the shelf in about the summer of 2020, I found that on Amazon, there were these things called elastomeric masks from 3M and from other companies. And I was like, what are these things? And wait a minute, Amazon is saying you can order it. That's strange. What's supposed to be a shortage of all this stuff? And then I started looking into it and understanding the technology. And being an engineer, I started understanding what it's all about and realized this is actually a mistake. People thinking that that there's a shortage when really there's plenty of these elastomeric masks. They last a long time. They can be used very effectively. In fact, some healthcare systems are using them. Most of them are not. And so I started realizing it was kind of a eureka moment. And my background is I've been looking at this not just as coronavirus, but also future respiratory viruses, pandemics. Because I was, I saw the trend of Ebola and Zika and coronavirus, and became very concerned that there could be even much worse viruses that come out in the future. So I've been looking for how can you solve this problem in a general way, and so then it immediately struck me that this is the solution to that problem. This is what's going to stop this pandemic, the next future virus, and this is everybody in their house. Everybody should have this in their home. And so that I started focusing on kind of looking at this. Does that answer your question?
Yeah, no, absolutely. Something popped into my mind when you were talking about Guinea. So What were they? What kind of masks exactly were they wearing in West Africa?
Oh, in Guinea, you actually weren't wearing masks. The reason was that the virus was not transmitted through the respiratory route.
Oh,
Uh,
okay.
it, yeah, so it was a contact transmission. And so, but however, I at that point I'd learned a lot about the exponential spread and how it can get out of control, and when it is under control, it decreases. And so, I've been doing a lot of work on research and mathematical modeling of these viruses and the spread and how to stop the spread. And so that's where that really kind of prepared me for what happened with us in coronavirus.
Cool. Shows how much I know about Ebola. But
Yeah, but however, if there is always that potential that a virus like Ebola could become airborne, which would
yeah,
be a nightmare scenario, given what we've seen with coronavirus. But there are viruses out there, unfortunately, that have that type of potential.
and so you mentioned the community action that they were willing to take in West Africa. So what were those specific actions?
We don't till this day don't know exactly what catalyzed the virus was going exponential from the September, October, November, December 2014. Then January, it really stopped going exponential, and then it started declining. And that was a fortunate thing. That is probably a result of a number of different factors coming together. There was a lot of public health interventions. A lot of people were building hospitals and treating patients, and so people were able to get a little bit better care. There was a lot of increase in testing, diagnostic testing, so that people were able to test early and prevent people take action to isolate after they became contagious. And separately, I think there was a lot of at the time. They were continuing to do these things like funerals where people would have close contact, even as I understand, may even have had contact with the corpse. And then, so if a person with Ebola had died, that would have been a spreading event, a super spreading event. And so similarly in the home, and so there was a lot of lack of recognition. Ebola, is this real? Because they're dealing with all kinds of other diseases too, like malaria and other serious conditions in those regions. And so there was not a collective recognition that this was a real thing. And then once there was a recognition that was a real thing, the understanding is that the people had started taking preventative actions to stop avoiding these types of spreading events and super spreading events, and taking hand hygiene, chlorine, and so on. And so that's what preventing people from getting in transport and avoiding so Ebola is very much more contagious through the contact route than perhaps even coronavirus is, and so through the physical contact I think that the combination of these public health interventions with community recognition that this is how it spreads is what we believe has stopped the spread. And then, of course, to eliminate it completely, it took many more months. That's why beyond January 2015. And so there's a lot of efforts, especially in Guinea, to identify cases, trace the source, and then isolate the infected people and stop the spread. So that ultimately is how it wound down, and it pops up again and again. Like more recently in the Democratic Republic of Congo, several times. I was looking at this and with my co-authors, and it was so that it's come and gone. There are different social factors as well. And it came back in in Guinea as well. And so then now it's been controlled. And so it's a recurring issue, but not nearly as contagious as coronavirus.
So are you a bit surprised that they were able to get Ebola under control so well, and then it as far as the public health measures with coronavirus, it's been just a constant cacophony of confusion, and just nobody's able to get a concrete set of public health measures underway. And as well, you mentioned coronavirus is so much more contagious, so it just went from being in China to everywhere in a pretty short period of time. So you're going to have all these different arguments over public health measures internationally.
I think I was not surprised in certain ways and surprised in other ways. The way I was not surprised was the leadership of the WHO and the CDC in and confusion in how to move forward. I'd seen that um, uh, in public health agencies in general. I've seen that in West Africa, being advising the president's office there. We had direct visibility into how these agencies operate, and we saw their strengths and weaknesses. And so as a result, that actually wasn't surprising. That was actually my concern. I was expecting this. I was deeply concerned about what would happen. So as soon as we heard about this, started writing op-eds and writing different things and trying to make a modeling and everything started to happen. So on the other hand, what I was surprised about in a good way was the effectiveness of certain countries in controlling the epidemic. And in fact, they had actually done the things really well that we had actually that we were advocating for. So take example South Korea. It's amazing how they had faced a real growth of the virus in their society, and yet you could argue they had prior experience with SARS-1, but ultimately it was more than that. The first priority for them was to get a test working, and that they could use whatever needed throughout the company, rapidly execute the test. They had also focused on high filtration masks called KF94s. These are the South Korean version of N95. Maybe it's still different, but at least it gets the job done. And so it's not a medical grade mask; it's a consumer grade mask. So they actually had a consumer standard for high filtration masks. And so in the combination of all the things, they were able to really control the spread of the virus and return to normal much more quickly than the other countries. So I was pleasantly surprised to see those types of examples where if you do it right, you can actually control the virus. And yet it's been elusive for most of the world, especially the United States, Europe, now India, and yet, so it shows that it's within our hands, within our grasp to actually control this virus. Yet, our public health agencies or the leadership has not been able to lead us in the right way.
Yeah, I'll agree with you on that one for sure. You mentioned before the issue with airborne transmission.
Yes,
and so I've been trying to balance out in my mind, if this is more of confusion from the top, or if there's any cynical motivation or anything. So you mentioned Korea and them able to use masks there, and for mass amounts of time, that's able to stifle the transmission, quite successfully. The inability to apply masks in most other places, do you see that as mostly try some sort of smoke and mirrors to try to get around the fact that there just was no supply at the beginning, or maybe there was more of a supply I'm just unaware of, or is it mostly around the confusion and debate around airborne transmission that has really been going on up until very, very recently? It seems that it's starting to shift with most governments, the WHO and the CDC.
The answer to your question, as I understand it, is a combination of all of those things. And that's why it's actually more complicated than it appears initially. Yes, there was a supply issue, especially for healthcare workers for disposable N95s back in 2020, and yet there was also a availability of reusable elastomerics, which are maybe not as preferable as disposables initially, or maybe the hospital systems were used to it. They were very reluctant to change. Generally, you have this problem in healthcare where the hospital systems adoption of new technologies can be very slow. So they just get stuck at doing the same thing over and over again, and they don't want to change. Whereas some hospital systems, like Allegheny Medical System, actually changed it for the better. They found that they actually prefer elastomerics, and they ran into a supply issue and solved the problem, as opposed to kept on doing the same thing and causing problems for the rest of the country. And so and they also at the same time, the narrative of scarcity stuck. And you'd see repeated reports in the press saying there's scarcity of N95, and then repeatingly, the public health agencies were saying this, the press was saying this. But then at the same time, when the supply balance actually shifted around late last year, maybe I can't pinpoint exactly when it was, but we started to see availability of N95 masks, even disposables, in October, November, December. And it's saying, well, this isn't consistent with all the headlines you're seeing. So not only was there a availability of an alternative to the disposable mask, there was also a shift in the supply demand balance where there was actually more available, and yet you kept seeing people telling you that there wasn't any left. And so but even though you could just order disposables and there was a manufacturer, then manufacturers actually had to come out and explicitly state that we have enough masks for every American. That only happened around in 2021. But they had to actually form a association and then come out with public releases to tell people, hey, these headlines are wrong. Stop saying that. And now these same manufacturers are actually shipping masks to India because they can't even they can't sell them. They basically saying we can actually provide them to foreign countries. So it's a little bit of a mystery as to why this continues to happen. And so that, and I think the other factor you brought up is the need for the masks. It was also the denial of aerosol spread, or the reluctance to embrace the new science of really not necessarily new science, but it was a refined science of aerosol spread. And other countries had quickly recognized it. Japan had quickly recognized it. China had quickly recognized it. So many countries quickly just said, all right, this is aerosol and we're just going to protect ourselves. But somehow many other countries did not. Is it because of initially, yes, there was some attempt by the public health agencies to mislead the public and tell them that it's not aerosol because we don't want you to buy N95 masks. And then they had later admitted that they did that, which really destroyed the trust that they had initially. And this was so that was a huge disaster for public health in general. But there's this above and beyond the manipulations of the public health agencies in that nature. There is a genuine doubt among medical experts who are independently associated, independent of the public health agencies, that whether or not the virus is transmitted at a significant rate through the small particles and aerosols and so on. This debate has been going on back and forth, and it's almost like there's no way to settle this question in an objective manner. And infectious disease community, there's been a question of how significant is aerosol transmission, and no one is able to settle this question in a unambiguous way. And I think it's pretty obvious to me as an engineer that you want to protect yourself from this. And finally, the San Francisco Public Health Agency, after a year, when they initially came out with posters they put up all over the city, they had posters with 4 people on a square, and then trying to show 6 feet on the sides of the square and the diagonals of the square, non-Euclidean geometry.
So the sides were 6 feet, and then this was also
the diagonal was also 6 feet. So it was kind of a joke, right? And so they put them all over the city, and people were like, "Wow," and then finally, so then 2020, April 2021, a year later, they actually put up a really nice poster. And all it did was said one thing. It said, "The virus travels in the air and collects indoors." And I posted that on Twitter, and people loved it from all over the world. Like I had so many people just like the tweet, retweeted. Like it finally felt like, okay, finally someone gets it, And it was a huge step forward. And so, why did that take a year? Because then now you can protect yourself from those things with the logical, interventions. And if we had learned that a year ago, we probably wouldn't be where with this position where hundreds of thousands of people dying, and so there's this reluctance to accept that issue within the public, within the medical community, and so and people who are not giving the right guidance, and so that I think is probably the root cause of this problem. Is why did it take a year for that poster to appear?
Yeah.
Why did the CDC take that long? Why did the WHO take that long to even use the word aerosol? This goes beyond the public health agency. This comes back to the entire debates within the medical community themselves, and so it's a little bit of a mystery.
And do you think it's going to cause some long-term trust erosion with the general public? Because it seems like that's caused a lot of the ire with people with something that you'd think otherwise wouldn't be that big of a deal, just getting people to wear masks more and more, because it went from nobody needs to wear a mask to everybody needs to wear a mask. And I think a lot of other cynical actors have utilized it, like they've got too overwhelmed about Fauci going from saying no mask to two masks, and then it has become this big political mess. How long do you think it's going to take to clean that up? And in dealing with the post-mortem of the pandemic, is there going to be any ability of figuring out what occurred and an honest analysis of what occurred, so for the inevitable future pandemic, if it's an airborne one, that we can have it all figured out, that when this happens again, masks are needed?
I am a little perplexed because it's now self-evident that people need the types of masks that everyone should have disposable or reusable N95 level masks readily accessible. I have a list on my website, patientknowhow.com. It's very simple. Just show them what they need to do, and they'll do it. Yet the public health agencies went from no mask to this ineffective, the partially effective cotton mask. Not ineffective, not that it doesn't do anything. It does actually help. Mm-hmm. And so that's important to recognize. But then they were partially, and then they went to double mask instead of recommending things that are off the shelf like elastomerics. But even the double mask phenomenon most recently, I was like, why? They didn't have to do that. They could have just said, there's these beautiful masks that are off the shelf. You should use them, and they're available to you, and let the demand, consumer demand, drive the production. And yet they went for, they invented this half-baked solution called double mask, and if you have nothing else, sure, it's a good makeshift solution. It's like MacGyver solution, but there's no actual need to do this. You can get highly well manufactured solutions that work much better, that have a good fit and filtration. Really, the solution here is fit and filtration, in 2 words. That's all you need to remember. You need a good fit for your face, you need good filtration, and that's what stops the spread through around the mouth and the nose. And why is that hard for people to recommend, and why do they have to go through these circuitous routes to get there? It baffles me, so in that way, I think we actually know a lot of the answers of how to solve this problem from a consumer and engineering and technical perspective, but many doctors, like my co-authors, have actually recognized this and have been asking for use of these types of masks. Yet that's not coming from the public health agencies. I mean, it's not because they're incapable of doing it. There's people within those agencies that also recognize this as well. But it's like the CDC director. We had high hopes when the new CDC director came on board. She had talked about in an interview in JAMA with last fall, saying that there's a lot more aerosol spread than anyone recognized. And so we thought, oh, she actually gets it. That's great. We're looking forward to all the changes that she's going to bring. And then, she doesn't do any of this, and she doesn't recommend the public to use high filtration masks. And then in a press conference at some point, she said, there's been no cases of. There's been very little evidence of people who are wearing well-fitting cloth masks getting infected. And I was stunned to hear this. Like, this is how can you make such a statement when we see so many events? So some of those cases are documented in my HBR study. There have been subsequently more where we've had documentation. It's very hard to document in enough level of. If you're waiting for documentation, you're going to be too late. But yet there are now some documented cases, and it takes painstaking to get all the details and all the conditions right where you can even capture. So this is not a. If we could, have some kind of a micro drones that are measuring the transmission of the virus at different places, yeah, sure, you could document everything and get exact data on where and when things are happening, but you can't. So it's very clear, and now they've come around and they said, yes, there is aerosol transmission, and that's actually maybe the primary method. And there's a lot of people in the CDC probably. So it's unfair to say that the entire CDC believes one thing, because what happens is there's often a debate in the CDC where some scientists are on one side, the other scientists on the other side, then they finally come up with a unified message. But now they've actually recognized that there's a aerosol spread virus here, and so maybe this paving the path forward to change the. But this has taken, initial mention of aerosol was last fall, and now they finally come out and said it's actually a major part of the transmission. So when is it going to change? It's too late.
Yeah,
that's basically the answer.
Yeah, and there's been enough surprising things that have occurred. Like I just found the double mask thing so bizarre. So
I give him credit for coming up with being having ingenuity and saying that if you have nothing else, that's a good alternative. But when you have much better masks, it's a mistake.
Right.
Yeah, I'm not making my own shoes. I'm buying shoes, in this day and age. I mean, I don't know anybody who makes their own shoes, and especially even in developing countries. I don't see people making their own shoes, and it's not worth it.
Yeah. Let's take a sidestep. You wrote, or you co-authored a piece that was published in the Washington Post 8 days ago now.
Yeah.
On what could be done in India. First,
yes.
Go over who your collaborators are and what's the basis for that collaboration, and then also what you guys wrote in WAPO.
Certainly, I've been collaborating with these co-authors for a number of years. Ranu Dhillon and I wrote the initial papers on Ebola in 2014 with other co-authors, another team of experts in a number of different fields, in modeling, in diagnostics, in infectious disease, and we've been describing the benefits of rapid diagnostic tests for many years, and finding a lot of resistance at the public health agencies to adopt them, and that has been with us for a long time, and we've been publishing paper after paper saying that we need to be prepared for next thing with rapid diagnostics, and it was we've talked about the Ebola, with Zika, and now with coronavirus, and so that's been building for many years, and then we saw how slow the adoption of rapid diagnostics has been, even with coronavirus. It was still a very long route to get to the point where now these things are commercially available. It was a year into the pandemic when really we needed them a year ago, 6 months ago, maybe even taking something that was maybe even not perfect but good enough, and it was but yet that didn't happen, and so it basically became a much bigger issue during coronavirus that became a much more public debate in Congress as well, whereas it was kind of ignored for several years. So that was my background of how one of with Ranu Dhillon and Abrar Karan also started in 2020. We started collaborating with this. We all together wrote an article called "We Need Better Masks" in Harvard Business Review in I think it was May 2020, where we recognized that the masks that people were using were recommended by the public health agencies. To put a cloth mask over the over your use a T-shirt or something. It was not good enough. It was certainly better than nothing. Again, better than nothing, but it's certainly not good enough. And to prevent infection, especially for people who are exposed to it on a daily basis. And it was so then we started looking for masks. Okay, our assumption was we needed innovation, and we needed something brand new, and we needed to unleash the innovative energies of the community to make new masks. And there was it was probably the golden age of masks in that respect. A lot of new masks coming out, a lot of new designs, and so on. But then later in the year, I realized, wait a minute, we don't actually need to make new masks. We have them. They're off the shelf. They've been making by large scale industrial grade masks that have a high standard of efficiency and breathability and filtration efficiency, breathability, and fit. And they're available for a low cost. And that's when I published this article with Brar and Ranu and other co-authors on essential workers need better masks. That was in the fall of the end of the summer, fall of 2020. And prior to that, also for the California State Firefighters Association, I published this in August of 2020, maybe it was July, but where these masks are available to for essential workers, to even for anybody to to get, and that then led to another bunch of other articles, and we published, and then ultimately published these in multiple pieces in Washington Post, in Harvard Business Review, and a number of other places, and for the United States, saying the United States should adopt a policy of recommending these high filtration masks to essential workers especially, but also the general public. And that didn't happen. It probably should have, and I think we would have avoided a lot of pain and suffering. And so then the India crisis came out. Suddenly, everybody it really took everyone off guard. India was coasting along, enjoying a lot of open society and celebrations, and meanwhile, coronavirus was slowly seeding itself throughout the society, especially in the urban areas. It almost like echoes of what happened in Los Angeles in the December-January timeframe, but on a much grander scale. In December-January, Los Angeles was in a similar position. It was actually moving along quite well, the metro area, and people thought, and then suddenly you start to see cases rise, and then it became clear that it was going to mushroom into something much, much larger. And by January, we started seeing oxygen shortages and hospitals, constantly hearing ambulances, and all the things that we're seeing now in India. We're basically seeing a lot of those in Los Angeles, and so they had their second wave. Unfortunately, California had its second wave, but specifically much more so in Los Angeles, even than the Northern California. Although the Northern California also had its second wave, but not nearly as bad. And so then the India crisis came out very, very suddenly, very quickly, and we believe it. At least right now, there's a belief that it's somewhat attributable not just to the general relaxation of control measures, but also to this emergence of new mutants simultaneously that are much more contagious, much more just anecdotally. A lot of my extended family managed to avoid coronavirus for this last 12 months. And then suddenly I'm hearing a half a dozen of my extended family in India getting coronavirus, multiple people in the same family getting it. So there does seem to be something very different about this mutant or this time around. And so we got really concerned, and essentially we had been prepared by the rapid testing as well as the work on masks. And then we really said, this is the time to apply these measures now, because vaccination is not going to solve this problem in the near term. Yes, we want to push as far as we can with vaccinations, make the raw materials available to India, get them to make all the vaccinations, no doubt keep on going. But no matter even the best case scenario, those are not going to be available in large quantities until later this year. And maybe it'll take a year, maybe it'll take 12 months, maybe take 18 months to get this thing. But if you want to do something now, what you've got to do is utilize the available resources of the high filtration masks all over the world that are in excess, as well as available rapid tests, and then deploy them in India very effectively. That's what you got to prioritize right now. Just take a very short-term approach and utilize these resources to control the spread of the virus. And getting people to accept that has been some people see that and understand, but I think it's believe it or not, it's seen as a novel point in India. Even though we've been saying this for years and months and years, it's still not recognized among the public health community as the first priority.
So a common thing in many places.
Just to give you an analogy, I think it's like you got a fire in your house and people are talking about fire detectors and fire retardant materials. Yes, of course, you need those things, and those will help in the future. But right now, you got to put out the fire with the water, and stop the spread of the fire from household to household.
Yeah, no, that's a very good way of putting it. You mentioned the variant presently in India, or variants, I guess I should say. Do you have any insight as to what might be going on there, and if there's any sort of reasonable data that's anybody can wade through to figure out how much more contagious this is, or what is possibly going on there?
At this stage, we have to live with limited data because all the data is not out. And if we wait for all the data, we will be it will be too late. But what the signs that have come out of India are not reassuring. The WHO yesterday just released a statement saying that the Indian variant is now a variant of concern, and in fact, there is some evidence that it evades vaccine protection. And it's obvious that or not obvious, but it's not. There's really there are signs that this virus is far more contagious than its earlier variants, and there's some modeling coming out that came out of IIT Kanpur that looked at the case counts, and no doubt the case counts are undercounts, because they're not testing everyone that could be tested, but the available case counts looking at it as a barometer of the virus spread, it does show that the virus has the spread of the virus is often characterized by something called R, which is the rate of contagion from one person to more, how often it spreads to another person, to other people. If R is greater than 1, that means that each person on average who's infected on average infects more than one person. If R is less than 1, it means that each person who's infected on average infects less than one person. We want R less than 1 because that means that we ideally want it 0, but we'll take R less than 1 if it'll reduce the spread of the virus. R needs to be sufficiently less than 1 to stop the spread in a reasonable time frame. Instead, what's happened is that in their calculations, R was less than 1 from up to about February, March. So November, December, January, there was a lot of press articles coming out that India has avoided the pandemic, and that there's all this great, people are using masks, and all these headlines. Why is India not surging? You can see articles from that time frame in NPR and other sources, just asking this question. And there were, public health agencies in India were taking credit for it too. They were saying, "Yeah, we did a great job. And, we got it under control. See, we did a lot of testing, and this and that." And so, yeah, but then what happened is February, March, these professors, they computed that R actually shifted from less than 1 to greater than 1 around that time. So then something fundamentally changed. And then very quickly afterwards, you start seeing the consequence of that, where the cases mushroomed very fast. It went from I don't think we've ever seen a graph that looks like the Indian graph where the viral spread went almost vertical. Typically the curve, it's like a bell curve,
Yeah, I've seen some, but in much smaller places, like when the B117 outbreaks happened in Ireland and Newfoundland.
Mm-hmm.
It was the same. It was the same sort of thing. But then again, too, Ireland's 4.5 million people, and Newfoundland's 500,000 people compared to India. But it was the exact same thing, just 0 to 11.
So it caught people off guard was what happened. Is it was not as transmissible before, and then it just shot up, because whatever they were doing was good for the previous variant, but not good enough for the future variant. And that's what that's a good point, good observation. It has happened before, but not in this grand scale or this humongous scale. And so
time too, like I noted Ireland and Newfoundland, and like that's sort of like a few days or something. Like this rocket to the moon has been going on for I don't even know how long now. So it's so that duration is much more extreme.
Yeah, very, very, very concerning. And so I think the answer is there's also there was actually a headline too where they said that people arriving from a particular state in Andhra Pradesh in India, if they were traveling to Delhi, they had to self quarantine for 14 days. So within India, that kind of tells you that the local public health agencies are taking mitigation steps that are more even beyond what we would expect. So there's some new variants emerging in parts of India that are really stressing the system, and so all these signs don't point in a good direction. There's something very serious going on that the world needs to pay attention to, because if that then spreads around in other places, it is spreading actually. In fact, there's signs that other neighboring countries in India to India, the South Asian continent, are seeing similar growth. Nepal, Sri Lanka. I'm not sure. I haven't kept track of Bangladesh and Pakistan, but I would imagine those are also at risk. Those countries, and so it's a very serious problem that is now threatening global security. It has been threatening global security, and now it's even worse.
Yeah, I haven't had a chance to look into what's going on in the neighboring countries. Like I've heard it's not going good in Nepal, and like they're generally quite poor and have low health infrastructure. Is it getting pretty out of hand there?
That's what the reports that I've seen. Yes, it is out of hand. There's people reports of people getting coronavirus on the Mount Everest.
Oh yeah.
Climbing. I mean, it doesn't. It finds a way. From person to person, somehow it hops. And yeah, it's a. I guess it's probably the most successful communication of anything in history. Like in terms of how it was able to spread across. I make this analogy. It's like the aerosolized internet. Because it finds a way to transmit this information, the virus, throughout the whole world. And we on the other hand, we have the ability to stop it, and we have the ability to control it with the available technology. But we're not using it in a way that is effective. That's kind of the tragedy of this whole thing, is that if we were to only adopt the right measures to control it, we could be out of this very quickly.
Yeah, that's absolutely right. Like the big thing is to cut the mode of transmission through whatever means, and at this point in time, so many people, like the lockdown issue is really worn people down, and it's getting much and much less politically viable. And like, so the big thing is with masks, and as you mentioned, like there's no time to wait to see how deep the rabbit hole is with these couple new variants in India. And it's best to get it under control as soon as possible. Um, has there been any big campaigns to get a lot more masks to India? And
There have.
yeah, well, what are those exactly, and how well are they getting underway?
Well, I think I saw that the United States government was sending hundreds of millions of masks, N95 masks, to India. So there's been a government efforts to, as soon as there was a crisis, I think they sent an airplane worth of stuff, oxygen containers and various supplies, and among those was masks, mostly for medical use, as I understand. There are also now emerging efforts from these manufacturers who have who declared they have excess inventory and available stock to supply America. They also realize that they can meet the crisis in India too, and so they are there's an American Manufacturers Association, Mask Manufacturers Association, AMA, led by Armbrust Industries, Armbrust USA, has started shipping millions of high filtration masks, surgical masks, maybe N95 as well, and to the Delhi government and to the non-governmental organizations in India. And they're working on initially the 2 or 3 million first shipments, and then they're now going to expand that to. They aim to expand that to hundreds of millions. They literally had to figure out kind of. Put the airplane together as it was taking off. They need to figure out the logistics. For a couple of weeks ago, it was like, how do we even get masks to India? And then the logistics companies came in and started collaborating with them, and they were able to form partnerships to find logistics. And now they're looking for partners on the ground, in India, who can receive these masks and distribute them and use them effectively. So there's now my co-author also is his NGO in India. He's also on the receiving end of this. He's receiving these masks and is going to implement them in his area in Madhya Pradesh, where they are going to distribute these masks, I believe, to the local population so that they can use them on a daily basis. And so I think they're going to try to they're going to use these high filtration masks from Armbrust, and then these are surgical masks in combination with fitters that can fit and seal the mask around the face. And so this is a very good alternative. If you have a fundamentally high filtration mask, surgical mask, but doesn't have a good fit, you can fix that with a elastic fitter, and that may be a very effective approach. And so they're working on doing that, and that's proceeding forward. So there are a number of efforts both at the governmental level and the private sector and non-governmental level that are emerging, and this is all happening, and this is a great progress, but it has to happen at a much larger scale for this to get under control across the country.
Yeah. So what are the what are the quantities of masks coming in through the government and the NGOs?
I mean, I've just seen reports from the government. There's some, I'd have to check and see, but I think it's something around either tens of millions or hundreds of millions of these masks. And then, of course, healthcare agencies use them very rapidly, so that's a different type of use. But public can use them much less frequently, and the replacement cycle doesn't have to be as fast. And so we remains to be seen. I think they're initially starting, to get the first shipments out. They're sending about 2, 3 million, 4 million masks, but they plan to expand that to hundreds of millions. I think if permitting, if the funding and the logistics and the partners all cooperate in India, or they have the complementary chain all worked out, then there's no limit to how much this can scale up. And there's many other masks around the world. There's from Korea, KF94. It's really a problem of demand. If they recognize that the first priority should be to get people the right high filtration masks, maybe if the Indian government were to say that directly to everybody, really the priority here is wear a mask, but if you can get one, wear a better mask. And here are some good options. If they were to do that, that itself would catalyze the entire private public sector NGO community towards that goal. And right now, they're focused, rightly so, they're focused on oxygen and treating the patients who are in the most severe conditions. However, that's not scalable. You're going to keep running out of resources. And, if this virus keeps going, you're going to see more and more cases. And so we also need to look at how do we control the spread. And this is a very simple way to do that.
So is there, should there be some sort of big messaging change coming out of New Delhi, or should the state health sectors be changing their initiative, and maybe is there any states that have really changed their initiative and messaging around masks?
I would like to see that. I would really like to see that, because that would make an immediate impact on this entire epidemic. I'm literally, it was on Indian TV this weekend, talking about this and how we have the power to solve this in our hands. And so hopefully that's going to lead to some change. I think there's the central government is very open to solutions. In India, I'm trying to reach the central government. The WHO has finally just kind of slid in the word aerosol into their messaging, as if it was like not a big deal. But and the CDC now has come around and updated their website. So this change is now being reverberating. I think it's being reflected in a lot of people's thinking. It's not as fast as we would like to be updated, but at least it's moving in the right direction. And I think it needs to move faster. So ultimately, it's very simple. They just have to declare, all right, everybody just make sure that you have a high filtration, well-fitting mask, and not these, and get it out however you can. And then let the supply and let the demand, suppliers meet the demand. Instead, right now, people don't even know that. They don't have the message.
From a lot of what I've seen from like the BBC, a lot of other press outlets, is trying to really, they're trying to find some sort of avenue to really push the blame on the federal government in India. It all comes back to Modi somehow. Is this is there any level of accuracy to that, or is this really a lot of theatrics on a part of the international press to try to get a very simple, streamlined narrative out there?
I think you put your finger on something, which is we've consistently seen, whether it's in the United States or other countries, to just need kind of focus on the political leaders. of course they're responsible, and we would like to. That doesn't help. We need solutions now, rather than the guidance from the public health agencies has not exactly been on the mark. So the governments ultimately, they execute what their agencies, at least sometimes execute what their public agencies recommend them to. And right now, we're not getting a good recommendation from the public health community as well as the government. So it does. I don't know if to what extent, unless you fix the public health community, the unified has a unified message that makes sense. Other than say, vaccinate everyone. Yeah, that's obvious. Of course, we would do that in a heartbeat if we could. And that let's keep on. Don't slow that down. But that's not going to solve. There's no realistic scenario in which that solves the problem in any short reasonable time frame. So until we accept that, and then debate becomes, you see, there's articles in India that are going viral about like we need a vaccine moonshot. And
a vaccine what? Sorry?
Moonshot.
What the hell's that?
Well, they're saying we got to vaccinate everybody. Like, this is a cliche. It's a cliche, right? And it's not going to, of course we need a vaccine moonshot. Who's not? That's not the problem. The problem now is that we need to stop the spread before we are able to vaccinate everybody, so that it's controllable, and then we can have a long-term solution, which is vaccination. And this is you're not. So in other words, even before you get to government competency, you're having a problem about the public health policy, and even public health leaders on Twitter or anywhere, they're talking about vaccinating everybody. That's not a solution in the near term, and they won't accept that. And so this has to change as well. And so there has to be a recognition that what problem do we have to solve first, and then let's go get the government to solve it. And I think without the leadership coming from the public health community, it's very hard to do that. And so that's why we're having to have me and my co-authors go on TV, talk about this. I mean, we shouldn't be having to do this on our own. We're not even. This is not our job. This is not our. We're doing this because there's a problem. No one's actually doing else. This is the job of the WHO and the CDC and the other health agencies to be doing this, and they're not doing it.
And the public health agencies should even know that this isn't really in their best interest, because the international vaccine is going to take forever.
They should, yes, that's right. And there's a problem here, and it's hard to decode exactly where and how these decisions are made in the public health agencies, and we've clearly seen so many signs of both, and not just internationally, but in the United States with regards to U.S. policy, how we feel they've not been on the mark in terms of recommending the right solutions. Just coming back to, we had this essentially we're replaying what we had seen in the United States just a few months ago. We were several months ago seeing the lack of first we went from cloth, no masks, and then the cloth mask, and then to double mask. Why don't you go directly to the answer, which is just buy the masks that are mass produced and available, and manufacturers are ready to supply them to the general public. I mean, just go directly to the right answer. It's not that hard to recognize this, but yet it's been this tortuous or circuitous, and still never finally getting there. And so that's what so we're trying to solve that problem during a crisis of unprecedented proportions. Mm-hmm. In India, and so maybe there is a chance that we will solve this problem in India, and then the message will stick, and so it should be, it can be solved very quickly. In fact, if the Modi government were to recognize this and were to say there's an opportunity here to stall the spread of the virus with high filtration masks, and maybe secondarily rapid tests as well, but primarily with high filtration masks, we can avert a humanitarian disaster that is unfolding right now. And I sincerely believe that a lot of people's lives would be saved if they were just to make that kind of change.
Yeah, and it is a humanitarian crisis. Like the amount of people that are dying every day, it's absolutely devastating. And do you have any idea as to how much higher the actual calamity is daily than what is being reported? Because there's no way that it's just at the levels that are reported daily.
Yeah, it's a really interesting question. The Ashish Jha on Twitter had posted a thread uh, for a uh, uh, for a uh, uh, for a estimate using the actual trying to tie the deaths to the actual number of cases, and it's a what they did is they basically used that to estimate how many cases that are coming in through the testing, but actually when you look at the number of deaths, how many cases should there be out there because of the asymptomatic spread and so on, and they're not getting tested. And he did actually address that, and so I. So I would definitely refer to that analysis, but it's many times more than the number of cases that are being tested right now. So I think we should assume that it's anywhere from maybe more than twice, if not five times, what we can measure. And there's some that's happened everywhere. In a lot of these countries, like the United States included. I don't think we capture all the cases,
No.
especially the asymptomatic ones. We have no idea how many people are truly asymptomatic in this in any of these countries.
Yeah, no, nowhere would it'd be impossible. And so they'll be figuring that out for years to come, like how many cases might there have been at X time, and how many people actually died and might have escaped the accounting. But just in India right now, like I don't think there's ever really been a place, except for maybe very early on when there was no testing and everything came on really fast and it was a big panic. Like since then, I don't think there's been a place where the case count and death toll would be at least 2 times higher. It's just quite extreme. Is
Yeah.
there? Go ahead.
Oh yes, yes. I think that there's a lot of undercounting of the deaths as well in India, and maybe less so than the number of cases, just because the deaths are much more objectively observable. I think, and but there is a belief that even the deaths are undercounted, and so there's no way to know really for sure. But these estimates can be done. I think public health community is doing those estimates, and yeah, it doesn't. It's not. It doesn't look good for sure.
Is there any other campaigns for, or I shouldn't say campaigns, just masks coming in from the big neighbor to the east, or is there some sort of spoiled relationship issues going on there?
That's an excellent question. I do understand people do use KN95s, in India, and so yes, there must be trade, happening, and there's clearly a lot of tension as well between the neighbors, but and that's exogenous to coronavirus, but it's yeah, certainly it's certainly an important part of the mask supply is coming from China, and only question is to what extent, how effective are they? Depends on the manufacturer. As we found in the United States, some manufacturers deliver good product, other manufacturers are not. The filtration efficiency is not high enough, or for whatever reason with the KN95. So it's hard to, unless you have a verified manufacturer that is a reliable manufacturer. It's hard to say that just buy an off the shelf KN95 and say it works. And whereas N95, the tests that I've seen, as long as they're not counterfeit N95s, they're real, from a validated supplier, they generally are very reliable. So that is one of the concerns about these masks, is if you get one that's not that's been from a unreliable manufacturer, whether it's counterfeit or if it's not manufactured in the right way, you can end up with something that doesn't work, which is of course a health risk.
How is that able to occur, that you have counterfeit masks?
That's a great question. The CDC actually has a list of counterfeit masks. They've identified and found different people, and they track it down because they're looking for this stuff, and they have a whole long page of all the different companies that have produced and supplied counterfeit masks. Apparently, even 3M masks there's a lot of there are counterfeit masks that are been reported where the masks essentially look exactly the same, like a 3M N95. Yet they're when they test them and they find out they actually didn't even come from 3M. And so this is a big, there's opportunistic manufacturers out there that are basically making, willfully making counterfeit products, which is very disturbing. It's not something. So that therefore the source of the mask is really important. Making sure that these are not, I guess the demand is so great that all these some producers are actually doing this kind of illegal stuff. But
go ahead.
Yeah, I think obviously you got to try your best to get it from a source that actually is an actual product as opposed to the fake stuff.
So what are the specific issues with these counterfeit masks? Like, what are they making them out of, and all that, and what really specifically differentiates them from the real deal?
Well, I mean, they on the surface look exactly like the original stuff, and so what you have to actually test it to figure out this is actually not the real stuff, or look at the lot numbers or verify the suppliers and make sure that they got them from the actual manufacturer. And it's authentication of the of the source is really important. I believe Amazon and other major distributors try hard to make sure that it's coming from the right place, and it's so the source is really important to verify that these are not what differentiates them. Well, it's the main important thing for mask is fit and filtration. If you don't have proper fit, or if you don't have a good filtration of the filter media that the air is going in and out of, that traps the particles that carry the coronavirus, it's not going to protect you. So that's the main thing, is that the concern about the counterfeit masks is that they are falling short on the filtration and fit and durability as well. So the mask may initially work, but then the N95 standard is able to part of the standard is to prove that it can actually last and it won't degrade over time as you use it for 8 hours or some number of time. And so that the durability is actually a really important piece of this. That's why the N95 has so much, is used and trusted, is because it has that durability and quality control as well. So the quality control is another aspect, which is making sure that a batch that was produced today is the same as a batch that was produced tomorrow and day after, and verifying, doing spot checks to make sure that the manufacturing process. So even if the original mask design was good, sometimes masks can stop working due to lack of quality control, and that the lots that they manufacture might not be the same. And so that's what part of the N95 standard is, to verify that the masks that can be consistently made to the same standard and they work, and you test them and retest them and so on. And so those are all parts of this. Why it's important to get a real N95 mask as opposed to something that's made by a counterfeit or a cheating manufacturer.
Now, jumping back to the United States, like there's beyond government messaging, just amongst the population, just masks are. I don't really see it getting better. It just seems to be getting more and more contentious. And there's such a significant amount of the population in the U.S. as well as other places that are just not getting on board with masks and find it to be a massive civil liberties issue and a massive political issue. What could you see to really change a lot of people's mindset that have really put themselves in this really ardent position in opposition to masks?
That is a good question. It's I don't have a good answer to that, and I think the answers may be different for different people. I think not looking at it as a pro-mask and anti-mask type of binary thing, but looking at everybody has their own decision and reasons for why they are deciding one way or another. and trying to address those concerns. And again, I don't think we can or are able to convince everybody to adopt a certain thing. But many people may feel that they don't want the discomfort, or they're not convinced of the reason, or they think what they have is adequate, or they don't feel they're at risk. There's any number of reasons why someone might choose to use a mask or not use a mask, or use the right mask or the wrong mask, et cetera. So uh, it's not a something I would look at it much more nuanced, and address it as on a case by case basis, rather than there's no one answer to that question. Uh, but I do see that there's a difference in adoption. Like we've measured. The LA Times had a article in the fall of 2020 where they looked at usage of masks of people on the street in Los Angeles, and they actually put a nice little user interface where you could do the same experiment in your town. They found that actually in Los Angeles, the adoption of masks varied from neighborhood to neighborhood. Some neighborhoods it was like even closer to 50% or less. Other neighborhoods it was much higher, 80%, 70, 80%. And I was intrigued by this, and I actually did some measurements comparing LA to San Francisco during the surge. When there was a surge in Los Angeles in December, January, I was like, they could actually benefit from greater adoption of masks. And it turns out that the usage of masks of people on the street was actually much lower in LA, especially in neighborhoods, than it was in San Francisco. And so there's actually some question was made: is the usage of masks actually driving some of the difference in the pandemic spread in both regions? Because in San Francisco, consistently, even in the lowest neighborhoods, we saw around over 80% correct usage. So this Los Angeles Times article looked at not only whether someone's using a mask, but are they wearing it correctly? So some people wearing a mask, underneath the nose, or not, or not at all. And so when you look at the correct mask usage, over the nose, and you can go on the street. And so I've measured this in multiple cities across, say, San Francisco, multiple neighborhoods in San Francisco, and like Santa Cruz and Los Angeles, and I'm looking to actually expand it to other parts of the world. And there is a difference in these regions. What explains it? Is it a cultural thing? Is it it's hard to say exactly. Political thing? Is it is it something else? I think it's different. Each person has an individual decision.
So is this measurement able to keep track of overall, like, complete proper fit, or just if somebody has it, way down off their nose or something like that?
Yeah, it's a very simple observation, more like that, which is like, basically, you go to a street corner and just watch people and say, all right, let's count it. You click if they are wearing a mask, looks like it's correctly. You click if it's wearing it underneath the nose, click if they're not wearing it at all. And you get this final result after about 200 masks. You can see what percentage, you can calculate, and then you now have a good idea of what the average behavior is. And then you can see, some people clearly are open to wearing masks. They're putting it underneath the nose, and but so maybe it's just a usage issue, or maybe it's not taking it seriously enough to put it over the nose. Like who knows what that individual is doing. But it is very interesting to observe that there is a difference in different regions, which may actually be important from a public health standpoint. And we don't, there's been some studies looking at this, academic studies looking at universities, but I think it would be much more interesting to look at this in cities that are experiencing coronavirus outbreaks, and see what percentage of people are actually correctly using them.
Yeah, it is interesting that it jumps so much from neighborhood to neighborhood. And I remember, like, here in Saskatchewan, like in Saskatoon, early on, before there was any sort of provincial mask mandate, that I'd go to one part of town, and I'd say about maybe 30% of people were wearing masks, and then I'd go to another part of town, it'd be about 1%. You could see such a huge change like that, just depending on the demographic that are typically going to be in whatever part of town. Yeah. You have a a website up.
Yes.
Go over what your website is and how you got started on that and what you have on the website.
Yes, it's a great question. Uh, as I mentioned earlier, during the middle of 2020, I recognized that there was a scarcity of the disposable N95s. But then, as I was looking at what other alternatives, I discovered that elastomeric masks were readily available online and could be ordered on Amazon. They were available from a company, separately directly from the companies as well, like the 3M elastomeric mask. There was a Honeywell. There's a company called Envo Mask that had a mask that could be ordered as well. And these, I was like, wait a minute, these are N95 approved masks, but there's no shortage. Why are they saying? And I contacted the manufacturer, say, do you have a shortage? I said, no. And so I was perplexed, and then I realized this is actually something that everybody should have access to. And so I started writing about it for the California State Firefighter Association and then for Harvard Business Review and for other places, and then just because I realized that there was a lack of awareness of these alternatives, and people should know about them. I just put up a list on my website saying, hey, and then when I published another article, I got some good feedback saying that this is really helpful. Thanks for putting this up, and then I realized that so there really is a need for someone to actually be out there, and apparently no one's actually putting up this information out there on the whole internet. So I started adding more details and providing more information to help people understand the availability of these options, and these are readily available. And that's news. And this is something I thought the CDC ought to be doing, or some public health agencies like San Francisco Public Health ought to be doing, and they were not, unfortunately. And so no one was talking about it. So that's why I started. Assembling all this information together. Now there are many good high filtration, high well-fitting masks available. We've put a short list on patientknowhow.com so that anybody can go there and just find a good enough answer that will give you what you need. So I recommend everyone to take a look at the website. Just choose one of the 16, 17 different options that are put up there, or find out new ones and tell me about it. I'm happy to learn about more. I actually do have added new masks after people contacted me and identified good options. So I've tried them out, and so there. This is a solvable problem, and that's the main message. We can protect ourselves from inhalation of coronavirus very effectively. We just have to have the right tools in our hands, and that's as an engineer, that's kind of how I think about it. Is that we can solve these problems, and we just need to know how to do it.
What are some of the more recent and newer masks that you've come across lately?
Initially I found about the 3M elastomeric, which then got adopted subsequently by the Fire Department of New York as a standard, and then the Envo mask, where, as I mentioned, I discovered that it was a sleep apnea product that pivoted into so it has a nice. You can actually almost sleep in this mask, and then they designed it into an N95 mask. Not recommended for that, of course, but it's kind of, it has a really cushy feel, and so it can be it's very useful from that standpoint. And then subsequently, I learned about elastomeric masks from GVS, as well as disposable masks from GVS. And I was really surprised when I tried it out. This is a kind of other company whose whole business is safety and safety equipment. And they the disposable is the best fitting disposable I have ever tried. I've tried, like, there's a mask from the state of California that was given out to as well as state of Washington. A number of states did a purchase of masks from BYD, and those are good. And then some people are using them, but this GVS mask I found had a very good fit, and because I think it has a nose pad on it that I can show to you. Basically, it has it's something about the design where it's really fit, and also has a 99% filtration, not just 95%. So it's even better than a 95.
Oh, that thing there is a 99.
This is a 99, yeah, and it has this nose pad here. And so for whatever reason, as a result, is really excellent in terms of fit and filtration. So that was, I thought, was a quite. It's available online. There's a few others that have actually softer sealing materials, disposables that have that. And GVS makes an excellent elastomeric as well, plastic reusable version that can be last a long time. The O2 curve I use for my kids. It's quite effective. When I put it on, I don't worry about the fit. That's one thing I always have anxiety about. I was like, well, when I put it on, is it going to work? And here they put it on so well, and it relieves. It's not an N95 approved mask, but it does have good test results, and that's why. And this company's been in business for a long time. They actually have a tactical version as well that they use for the special forces. They co-developed with the United States and Canadian Special Forces, and it's designed actually to prevent aerosolized lead from to protect. When you do a gunshot, the lead apparently aerosolizes and get into the lungs. It's toxic. So so this is protecting from that. There's the Airgami, which is very interesting, which is a really creative design where they are it's designed so that with using origami principles, and so here's an example of one where it's actually kind of very nice, beautiful looking too, and you put it on, and because of the origami, the actual surface area of the mask is much higher than and so it's like twice or thrice this area of a normal N95 mask, and as a result of that, the origami helps it fit better, to clamp, to touch around your face. And then also when you breathe, it has more surface area, so it's much easier to breathe through, less breathing resistance. So that's the nice innovation that they came up with, that this company came up with, called Airgami. And so this is a really a unique type of mask that is very, very carefully engineered, and the tests are very good results. It's not N95 approved yet, but it has a very all the properties. It's utilizing origami for a very useful purpose.
Do you have a picture of that one on the website?
I do. Yes, it is there.
Yeah, okay,
in fact, National Geographic.
Check that one out, people. It's pretty cool looking.
Yeah, it's certainly. And there's actually a National Geographic profile done as well. It has a photo of that. But yeah, I think it's interesting how it's both. They take something really fun like origami, but they actually used it in a very effective way because the breathing resistance is a function of the surface area of the filtration material. And so with all the extra folds, you enhance the surface area of the filter. And so you can more air can go in and out very easily. So that the breathing resistance is measured by something called pressure drop, where, how when you inhale, what's the difference in pressure between outside and the inside. And that's what they've actually mastered. There's another mask that's called Fix the Mask. It's a concept where you take a lot of the world is using what's called surgical masks, and these are people find them comfortable, and they use them, and they put them on their and then in fact, the CDC director, former CDC director, would also use surgical masks. And but the thing with these surgical masks is many of them actually have really good filtration. Not all of them, but many of them have good filtration material, but they don't fit around the face. Mm-hmm. So as a result, they run into this problem where the air can leak in and out on the sides. So what this company in San Francisco has come up with, as well as University of Wisconsin, they have their own version, and they have this thing called a fitter. And what the fitter does is it effectively seals the surface of the it solves the problem of clamping, of clamping to your face, so that it's an elastic material that were designed with ridges so that it can create the fit for a surgical mask. And so now, before I put this on, my eyeglasses were fogging up. After I put this on, my eyeglasses don't fog up anymore, because it's sealed around my mouth and nose, and it's designed ergonomically so that it works. So it just works, and it's a remarkable and kind of an approach to take something that's already manufactured in high volume, where there's no shortage, and it can be improve the fit and filtration of that tech. So yeah, that's another interesting concept that's came out of this pandemic. and I would definitely look at that as well for if you prefer something that's disposable and cheap. You can use that, and the fitter is reusable and cleanable.
How much are those things? I've never seen one before. Like I've seen there's they're usually black and kind of like that big that's used to sort of tighten the elastics, I think, a bit behind your head. I've never used one. I've never seen I've never seen one of those. How much are those things? Because those things look really great. It just creates. Do you have that up on the website?
Yeah, I have a
The
link to
fitter.
that on the website, and you can buy it from the company directly. They have it. I think if last check it was around $30, but I'm not sure exactly the current pricing. It might be lower or higher, but probably not higher. But it's I think they have volume discounts and stuff. So it's it's fairly cheap. But you could reuse it for
Yeah.
indefinitely.
Unlike the actual surgical mask itself, you
The
can keep
surgical mask, yeah.
you can keep reusing that thing until, well, eventually the elastic's going to snap or something. But I'm sure that would take quite a while. Yeah, for anybody
Yeah.
listening, have a look at it. It's pretty cool. It's looks like a piece of rubber, and it creates a seal all around the exterior circumference of the mask.
Yeah, yes, exactly. Yeah, and also the other one I think I'd probably point out is another one is it's called the canopy, and the idea of the canopy is that it has it's a clear mask that is I guess it fell apart here, but
right, the old sci-fi mask.
Yeah, it actually has a transparent filter medium that basically goes around like here with this with an elastomeric sealing surface, so you can actually see facial expressions like this. You can look at it on my website, and basically it has it's one of the first masks and they're on the path to N95 approval, so they're expecting to get it anytime soon. Not yet approved, but for the first time you can actually see the face and see smiles, and this is really important in some healthcare settings. So it's being used in different parts of the healthcare industry. Like I think in Northwell Health System, the people are using it, and so it has some. It's really remarkable that you can get overcome some of the objection. There's just one of the reasons why people don't want to use masks is they can't see the smiles. There are a number of other elastomerics on the site, and there's also another option that people like is KF94, which is an option. It's basically a Korean version of a Korean consumer high filtration mask, and this has a reasonable fit. Not a good fit, not a great fit in my opinion, but reasonable fit, and it just works. It's $1, or less maybe, and much cheaper than an N95. But it provides some decent protection, and it's been one of these models has been tested by the CDC, and it also has a if you add a fitter to it, just like to fix the mask, you even get a much better fit. So I think it's another good alternative, and but these have generally been reliable in independent testing, the different KF94 models, and but this is one is made by Dr. Puri. The brand, and it has test results from the CDC. They're not the same level of rigorous testing, like the durability of the filter and so on. They just did initial filter testing, and it seems to work. So yeah, there's certainly a lot of good options, and I would there's no shortage of options for people to use and protect themselves with.
Do you know of any new masks that are sort of in the works that might be coming out soon?
Yes, there are definitely masks that are in the works. I think Honeywell announced a mask collaboration with let's see, what was that? They with a rap singer where they integrated both the. So one of the problems with these masks I find is that when I'm using my AirPods, the AirPods fall out. And whereas this mask apparently is an integrated mask with a sound system in it, made by Honeywell. So yeah, so there's there's new stuff that's out. People are coming out with that are, and it addresses that issue. Kind of. I think people are recognizing this is a long-term thing. Let's see, music mask. What's the name of that called? will.i.am and Honeywell unveiled $299 mask, and so you can check that out. That I think that was announced, and then it's called Zuper Mask, XUPERMASK. I haven't tried it myself, but it's intriguing because it's made by a mask maker who makes a lot of these masks, and hopefully has a integrated with a sound system, and so it addresses some of these issues.
$300, geez. But does it have does it have like does it have filters on the outside that you change out, or like what's the more,
it appears to, yeah.
Yeah, okay.
Yeah, it appears to. Yeah, I don't know too much about it. I can't speak to it because I haven't tried it myself, but it's intriguing. And there's a lot of mask innovation. There's a lot of new stuff that's out there that people are trying. Let's see. There's what else can I come up with? This is a good one. I'm not off the top of my head, but there is definitely it's the golden age of masks in that sense. There's a lot of new companies and startups that are working on great stuff.
Cool. Well, I think we should wrap it up. Is there anything else that you want to let the audience know before we take off?
Yeah, just to in some ways, the silver lining of the cloud is we've discovered probably the most effective protection mechanism, or maybe the most important healthcare intervention in history, is the high filtration mask that's available to consumers. It can address so many problems beyond coronavirus. A number of us on the West Coast of the United States and maybe even Canada experienced these wildfires last fall, where this air quality deteriorated beyond anything we've ever seen before. The particle count went from normally around 1 or 2 micrograms per cubic meter to hundreds of micrograms per cubic meter. This is really toxic, and when you step outside your house, even inside your house for that reason matter, but when you step outside your house, there's a need for to be able to walk around. You don't want to be breathing that stuff. It's very, very harmful and long-term cause long-term problems. And that these masks also double as being useful for that. So I do see this as and a lot of this is driven by, Dr. Fauci recently said masks may become a seasonal thing. Where because the flu basically was non-existent, almost non-existent this last winter, because of all the protective things that people were doing. Very few cases, and so I do see that people are going to be benefiting both from masks, even better masks like the ones we're talking about, and having them handy. And if there were ever to be a new pandemic or a new variant that comes out, the first thing I would do is reach for my high filtration mask. And it's or a new pandemic. There are much worse viruses out there, unfortunately. We haven't yet had to face them, but we should be prepared for them.
Yeah, that is the key thing, as we sort of touched on before here, is that this will occur again. When, who knows? But there needs to be some level of preparation for that.
Yeah, I think one other thing I'd also mention, just while we're at it, is the complementary technology is air cleaners. That especially for indoor environments where you can't wear a mask, like at home, or in a school where 30 kids are in a room, having a HEPA filter or air cleaner. CDC recently recommended them, and I think they're a worthwhile investment to put into every room. $200 to $500 devices retail, and they provide a number of benefits from the virus protection, but also wildfire protection. And they need to be turned on max speed, because that's the auto setting doesn't quite work for coronavirus. You need to actually run them at the high speed. But I definitely would recommend those for the same exact reasons as the mask.
Cool. And where can people keep tabs on you?
Yes, we're updating all the information on patientknowhow.com, and so you go there. We're going to keep improving and expanding that resource as we just find out that just to help people find the right stuff and get the solutions they need. To get, it's amazing how much of it is all within our hands, and we can solve these problems. And I think that's the main takeaway, I think, especially for India and for right now, but for any country who's facing these challenges.
Cool. And do you hang out on social media anywhere and punish yourself
Oh,
with
yes.
that?
Yes. My Twitter handle is SRI_Sri Krishna. So I'm on Patient Know-How as well as my Twitter. And so, yeah, happy to definitely active on Twitter.
Cool. Well, thanks so much for coming on.
Thank you, Joshua. I really enjoyed talking to you, and I also enjoyed your podcasts, other ones as well.
Thanks for listening to this episode. The music you hear on this show is from the Jeff Lapp Trio out of Montreal. Find them at jefflapp.com. Shout out to Tara for doing the graphics for COVID On Air. A huge thanks to my editor Jeff at Bean Co. Studios in Regina, Saskatchewan. Please visit endcoronavirus.org for more information on ECV. Click on Join Us. Through that, you can volunteer with ECV, and you can subscribe to our newsletter, which is full of great information shot straight to your inbox from our delightful newsletter editor, Tracy. Also, please check out the blog at ECV, and hats off to Scott, our impeccable blog editor. You can find ECV on Facebook and Instagram and on Twitter at NCovid19. You can find me on Twitter at Mr. Farden. It's at MrFarden. Till next time.